there. Welcome to our lecture today. We are going to talk about growth and development. Growth and development is really just a fascinating topic. We're going to learn about the different developmental milestones starting from birth through the first year. We're going to talk about what nurses look for in children in terms of normal development. And we're going to start out by just defining something simple, like the word growth. And so if we look over to our slide here, we can see that the definition of growth is the increase in the number and size of cells as they divide, resulting in increased size and weight of the whole or parts. And so this is a quantitative change. And what we mean by that is that it is defined in terms of numbers, right? We can weigh an individual and watch how their weight increases over time as they come back to the doctor and the child is growing. We are weighing them, and that is going to be a number that we're using to define that. That's a quantitative change. We can also measure their height, right? They come in each year for their school physical, and we check to see if they've gained some height. So growth is a quantitative change. Development is more of a qualitative change. So the definition that we're going to use for development is a gradual change and expansion from lower complexity to a more advanced, increased capacity through growth, right? Through growth, maturation, and learning. So this has a lot more to do with our development in terms of our cognitive development, our social development, the development of our language and how we communicate with the world. So development is a qualitative change. Which means that it's better described through the use of words and language, okay? And even though we might use some numbers when we are using different tools to measure development, we really think of it more as a qualitative change that takes place. This is part of my story. These are the Farmer triplets established in 2011. These babies were born to me and my husband at Mauna Loa in Oahu. We were blessed with these three little gems in August of 2011. And so I have personally had the pleasure of watching their journey through growth and development. They are going to be celebrating their 11th birthday this year. So what are some of the influencing factors on growth and development? So we know that heredity has some impact, and what this has to do with is a biological process through which the transmission of physical and even social characteristics takes place from parents to offspring. We know that we can have a parent maybe who has blonde hair and blue eyes, and then the child can also inherit that blonde hair and blue eyes from the parent. We also know that even certain types of personality traits can be inherited by children from their parents. He's got a bad temper, just like his mom does. And so these are things that we can kind of, and it's interesting because we think is it nature or is it nurture? What is it? Is it really that they have really actually inherited my sense of anxiety, or have they learned that through experiences that have happened to them? Well, we know that it's a little bit of both. And I have an interesting example. I have identical twin daughters, right? So my twin daughters, they're identical. That means that they came from the same embryo that's split in half, yet they're very different. One is very laid back and pretty easy-go-lucky, and the other one is really kind of type A. She's kind of high-strung, a little bit like myself, and she has a lot of anxiety. And so I've raised them both exactly in the same house with the same rules and the same environment, but they're very different, right? And so that probably has a little bit to do with her inheriting a little bit of my anxious type A-ness. So that's kind of a good example of that. Gender is another thing that influences growth and development in this way. Body constitution and structural growth of boys and girls are different. I mean, you know, the truth of the matter is that men are more muscular, and we have a different rate of growth even in boys and in girls. And so there is a difference in body constitution in terms of growth and development. We'll talk more about that too a little bit later. Other influencing factors include the environment, right? The physical environment. So in other words, does the child have adequate food? Do they have adequate shelter and clothing? We do know that children who receive really good nutrition tend to grow better. And also, there's even evidence that shows that children receiving love and nurturing grow better and faster. Our social environment, our culture, and our behavioral norms also impact a child's growth and development. So I'll give you an example of one of the ways that love and nurturing and physical environment all impact the growth of a child, and development. And actually, the example is in a premature infant. So it is well known that premature babies, first of all, they're born early and they're usually smaller than other normal babies that are born at normal gestation. And so what happens is these tiny premature babies, they found tend to do much better when they have something called, let me think, I can't think of what they call it right now, but I'll explain it to you. What it is it's when they take the premature baby and they lay it on the chest of the parent. So it has to be an open, bare chest, and the baby it's skin to skin. I knew it would come to me. It's called skin to skin when they lay the infant on the parent's body. So this is physical, right? Laying the infant on the body. They can hear the parent's heartbeat. They can be up close, have the warmth of the parent's body, but they're also experiencing that love and nurturing that is happening during those moments. And evidence shows that this helps the premature baby grow faster and develop some of the things that they're trying to develop, like a suckling reflex. So, for example, sometimes premature babies, they don't have a good sucking reflex and they have to get fed through a tube. Well, if you do skin to skin, then these babies, they grow faster, they start suckling sooner so that they can start taking their food in that way, and it's all good, right? That's all very positive outcome from a physical environment and also the psychological environment, including love and nurturing. And so with that being said, I want you to think about how growth and development can be impacted by television. Or can it be? It's a good question. We do know, certainly, that in terms of growth, kids who spend a lot of time in front of screens and snack a lot as a result of that, have a more sedentary lifestyle. And so actually in terms of their growth, they're at a higher risk for becoming obese. And childhood obesity is on the rise as well as obesity through the general population in our country. And so indeed, there are some positive aspects to being stimulated while watching things on screens. And so what we try to do is have screen time be limited. Does anybody know how many hours a day a child should have access to screen time? Ding, ding, ding. The answer is 2 hours. And I think our children probably watch the screens, whether it's an iPad or an iPhone or video games or DVDs, probably more than 2 hours a day. We're actually going to look at some statistics later on in the lecture. So I want you to think about how different things, and this would be more of an example of a cultural way that our children are influenced, right? By watching television, going on YouTube, and all that fun stuff. So we want to talk about growth for a little bit and how do we measure it. So pediatricians and other healthcare providers do follow a child's growth over time, and growth charts are used, they've been constructed by observing the growth of a large number of normal children over time. That's how we kind of get the norms. And so this is an example of a growth chart. We're going to go over this in more detail during lab. You're going to learn how to measure a child and how to plot it on the growth chart. And so these are from the CDC. The height, weight, and head circumference of a child can be compared to the expected parameters of children of the same age and sex to determine whether the child is growing appropriately. Now, one of the things to keep in mind is that we know that a premature baby is going to start off already being not falling in to the norms, right? And so there are different growth charts for premature babies, and I want you to realize that every child will grow and develop in their own way. So we have to be able to know that they might start out life being really teeny tiny. My daughter Violet, I think she weighed 2 pounds, 13 ounces when she was born. And each time she would go and get measured, she wasn't really compared to other children or infants her age, right? Because if you compared her at 6 months to other infants of her age at 6 months, she would seem extremely small. And it would seem alarming, but it wasn't, because she was following her own growth curve, meaning that from the time she was born up until 6 months old, the doctors could clearly see that she was growing in a healthy way, even though she wasn't at the expected weight of other 6-month-olds. So, where does this all happen? This happens at well baby doctor visits. Here we can see a nurse listening to a baby's breathing, most likely, if she's listening to the back of the lungs. And the American Academy of Pediatrics recommends that newborns are seen at birth, 2 to 4 days after birth, and then at 2, 4, 6, and 12 months of age. And the reason for this is many-fold. We want to see them this frequently because that first year of life, so much is happening. We want to provide what we call anticipatory guidance to the mother and the father or whoever the caregivers may be. So we want to measure their growth. We want to measure their development at these visits. We want to provide teaching about safety. We want to provide teaching about nutrition And we want to not only provide the opportunity to get immunizations, but provide teaching about the benefit of immunizations. And so these well baby visits are extremely important during that first year of life for these reasons. So in terms of measurement of growth, here we can see the baby on what we call a recumbent scale where they're laying down. We're measuring their weight. I want you to notice something about this picture here. The nurse never takes her hand away from that infant. So anytime you're handling an infant in a clinical setting, you always want to make sure that you have one hand. Now the nurse isn't interfering with the measurement of that weight because she's not touching the baby, although she has that hand there guarding the baby just in case that baby were to try and roll over and roll off of that scale. So I want you to keep that in mind as the nurse anytime you're handling these children, babies, infants. They are a very important little beautiful package of loveliness, and we want to be very protective of them. On the picture below, you see another nurse weighing a child who's able to sit up on the scale, which is fine. But again, notice the nurse's hand. The nurse's hand never really leaves the back of that baby to make sure that that baby is safe, because sometimes babies will flip back, and it would be really tragic if that baby fell and was injured. So really important to remember. Here we can see this crown to heel type of measuring that we do, and we measure an infant's length. We measure from the top of the head to the heel, so from crown to heel, and then also head circumference you can see being measured here. This is right around the crown, right above the ears. And also, in some cases, chest circumference and abdominal circumference may be measured, but normally it's just head circumference and crown to heel or recumbent length. So we measure recumbent length for infants up to 36 months. Once they can sit or stand up on the scale, we usually allow them to do that. And then weight and head circumference as well. So after that, we do the measuring. Then we take that information, we take those numbers, right, or that quantitative data, and we plot it on our growth chart. And so less than the 5th percentile or greater than the 95th percentile is considered to be outside of the expected parameters. And we'll talk a little bit more about what that means. But I want you to think of it this way. If they're less than the 5th percentile, what we're saying is that they are smaller, right, than the 5th percentile in that particular age range is going to be the very smallest of children, okay, in that age range that we consider to be normal. So if the baby or the child we are measuring is less than the 5th percentile, then we're saying that they're smaller than the smallest children are in that percentile that we consider to be normal, okay? Same thing with greater than the 95th. Greater than the 95th, we're saying that, you know, kids in the 95th percentile are the biggest kids and that age range that's considered normal. So if our kid plots out at being greater than the biggest kids, then we're saying, whoa, or do we have a problem with obesity here, right? Is the child gaining too much weight? And we'll talk about how we can measure that a little more later as well. So here we can see another growth chart. This one is pink. So it's for girls. And this one is showing birth to 36 months for girls, and it's showing length for age and weight for age percentiles. And if you look at it a little closer, you can see it starts in the 5th percentile for weight and goes up to the 95th percentile. It starts again in the 5th percentile for length, and it goes up to the 95th percentile. And so wherever our plot falls in here is where the child lands. Here's another one for males. Here's one for 2 years to 20 years for boys. So usually we measure from the age of 2 up to the year about 18 years old or 20 years old is still kind of considered pediatrics. And here we see body mass index. Body mass index is also plotted on the growth chart. We're going to talk a little more about that later. So when a child deviates from his or her previously established growth curve, investigation into the cause is generally warranted. So for instance, a decrease in the growth velocity may indicate the onset of a serious illness. And so an example of this might be, I know of a case where a young African American child who was being seen in a clinic was kind of following a nice pattern on their growth chart, and then all of a sudden they fell off the growth chart, meaning that he was always in between the 5th and the 95th percentile. So let's just say that as he was growing, he was in about the 40th percentile. Okay? That means that about 50% of the kids are bigger than him, and about 50% of the kids are smaller than him. So he's right in the middle. What happened was he ended up falling off and actually below the 5th percentile at a certain point for his age, meaning that he had lost a lot of weight, and nobody recognized that. It wasn't caught in the clinic where he was being seen. And it turned out the child had sickle cell anemia. And it turned out that the child became very ill and I don't think survived. And so it was quite a really devastating thing for the family and the clinic. And so it's something that we want to really try to be careful with when we are measuring the child's growth. Okay? So falling off of the growth chart is considered to be abnormal. All right, so enough about growth. Let's talk a little bit about development. Development, we said, was a qualitative change, a gradual change and expansion from lower complexity to more advanced, increased capacity through growth, maturation, and learning. And here we see children at kind of different levels in their development. But it's important to note that even a little baby who can't read will hold a book and turn the pages as though they are reading it. It's so interesting to watch them engage because, a lot of times they're just copying what they see us do. Here we see a kindergartner with finger paint, and we see an older child who is feeling really accomplished in the kitchen because she is learning how to cook. And so developmental task is a set of skills and competencies that are peculiar to each developmental stage that children must accomplish or master to deal effectively with the environment. So we refer to these as developmental milestones. So these are behaviors or physical skills that can be seen in infants and children as they grow and develop. So in birth to 1 year, these are just some examples of some of the developmental milestones. Able to sit up, babbling, getting your first tooth, playing peekaboo, saying mama and dada, understanding the word no, walking while holding onto furniture. These are all developmental milestones. And so there are different ways that we measure these. This is one example. This is called the ASQ3. This is an ages and stages questionnaire where when the family comes in to the doctor's office, we give them this quick little set of questionnaire that corresponds to the age of the child, and they check off all the different things that the child is able to do. Then we can measure that and make sure that they're doing what they're supposed to be doing at that age. There are other types of developmental screenings. The purpose is to quickly and reliably identify at-risk children for further investigation. And so the Denver 2 is one of the most widely used developmental screening tools, and this is what it looks like here. And just like the growth charts, you kind of look at it and go, I don't want to look at it. It looks scary. Well, yeah, it always does at first, but we'll spend some time in lab kind of unpacking it a little more carefully, and you'll get the hang of it very quickly. The Denver 2 is for ages 1 month to 6 years, and the scale reflects what percentage of a certain age group is able to perform a certain task. And so the tasks are grouped into 4 categories: social contact, fine motor skills, language, and gross motor skills. So I think we probably ought to take a little bit of time to talk about what those mean. So when we're talking about gross and fine motor development, this from infant to 1 year, we can give some examples. So we say gross motor is use of large muscles, so in other words, holding their head up. And fine motor would be small body movements that are more difficult to master, like grasping a rattle. And so that is the difference between gross and fine motor. And so here we see an example of head lag at 1 month of age. This is considered gross motor. And how this is measured is that the infant is laying down flat, and the provider will grab their hands and kind of pull on their arms a little bit, and their little heads just don't pick up and go along with that. And so we want to be very gentle with their heads. They need a lot of head support when you're handling them in the clinic. Newborns, and even at 1 month of age, we can see still some head lag there, even though they're kind of starting. Here we see a little more slight head lag at 2 months of age, where the child is kind of trying a little harder to stay in line with their larger neck muscles, to stay in line and not have their head flop back as much. And then again, we see no head lag by 4 months of age, where we pull them up and they're really able to keep much better, safer control over their head and neck. And so by 4 months of age, most infants can hold their head up with some back support and have no head lag. So this is an example here of what we call a supported sitter. This little guy is sitting in a boppy pillow, and even though he has that support on his back, we can see that even though his head's kind of crooked, he doesn't have head lag, right? He's able to kind of keep his head kind of up, and he's able to have that much gross motor control there. At 4 to 6 months of age, when they're prone, which is to be laying down on your tummy, you're able to lift your chest and bear weight on your forearms. This is another example of gross motor control. And at 4 to 6 months of age, pulling your feet to your mouth to explore is really considered more of a fine motor control, right? Because grabbing onto those little feet and pulling those little toes up to your mouth, that really requires some detailed movement, right? So that's fine motor control. At age 5 to 6 months, we see them start to roll over. Why do you think it's really important when we have parents come in for anticipatory guidance to teach about this rolling over at 5 to 6 months? Why is it important? Well, it's important because you never know when they're going to develop this skill. And if the child were to roll over off of that changing table right there, they could become seriously injured. And so that is a really good example of why anticipatory guidance is so important. We never know what age they're going to start rolling over. It can happen as early as 4 months. And so we need to be teaching about this. At 6 to 8 months, we can see that the child is able to sit alone without support. This is another gross motor function. And notice it's 6 to 8 months, right? So it could happen around 6 months, 6.5 months. It might not happen until later, okay? Here we see 6 months of age, many infants are able to hold their own bottle. This is an example of fine motor control. So I want you to think about it, not only grasping that bottle, but being able to pull that bottle up to their lips is very much a more mastered skill that is considered fine motor control. I can tell you that in my household, when all 3 of the farmer triplets were able to do this, our lives changed very much, dramatically, tremendously, because essentially they were able to feed themselves. This is an example of something called creeping. I never really even knew about this until I kind of started teaching this content, but I now look back and remember my babies doing it, and this is actually my son doing it around 10 months of age. It's when they stand up on their legs and they bend their little bottoms up into the air, and they use their arms to support their body, and it's just one of the signs that their arms are getting stronger and their legs are getting stronger, and they're ready to kind of start crawling. At 8 to 10 months, they can also do this and pull their entire body along the ground using their arms, and sometimes you'll see babies do this. And I remember when I first saw it, it seemed so odd to me that they can just use their arms to push their body along the ground before they actually get to the point where they're able to crawl, which of course looks more like this. And so at 8 to 10 months, they're crawling on all 4s. And again, once they get that locomotion, there is a great risk for accidents. And so again, anticipatory guidance is so important at this point for the family. So here we see them crawling on all 4s at 8 to 10 months. And some babies crawl sooner, for sure. This is called the pincer grasp. We see this around 8 to 10 months. And what it is, it's using that thumb and that index finger to grasp objects. So this is the pincer grasp. Definitely considered an example of some fine motor control. At 10 to 12 months, they may be able to walk independently or with the assist of one of these fun little contraptions like you see here in this photograph. But again, some babies may walk sooner, and some babies may not walk until after their first birthday. I don't think any of my babies walked until after their first birthday. And so I think we are going to kind of end it there for today. We will pick this back up next time. I appreciate your attention, and I'll see you again soon. Aloha.